Well, John, there is good news and bad news out of New York today. The good news is that the number of people who've died today is relatively flat compared to the numbers of those who lost their lives yesterday. The bad news, though, John, is that still 599 people have died in New York State alone today. That is still an extremely high number and brings the total to New York for nearly 5,000 people. That is why today, as you said there, that the mayor of New York has been forced to admit that he has contingency plans in place to bury people in mass graves in city parks once those refrigerated white lorries we've seen have started to run out, which they are beginning to run out. The details of that were disclosed by the chairman of New York City Council's Health Committee, who said today that the trenches would be dug in parks for 10 coffins at a time in long rows. He didn't say which parks, but he said on Twitter it will be done in a dignified, orderly and temporary manner, he said, but he warned it will be tough for New Yorkers to take. Meanwhile, the New York governor, Andrew Cuomo, today said that he didn't know anything about those plans. He was expressing some kind of hopefulness that the numbers appeared to be stabilizing, but he also stressed that New York hospitals were operating at maximum capacity. Let's hear what he had to say.
This is a hospital system where we have our foot to the floor and the engine is at red line and you can't go any faster. And by the way, you can't stay at red line for any period of time because the system will blow. And that's where we are. We are at red line. People can't work any harder. The staff can't work any harder. And staying at this level is problematic.
The governor there also lashing out at residents of New York City who he said appeared over the weekend in the sunshine to be violating those stay-at-home orders. He said it was wholly unacceptable and he has doubled the size of the fines from $500 to $1,000 for those caught wandering around the city without a legitimate reason to be out. John.
Siobhan Kennedy in Washington. Now, as New York City hospitals become overwhelmed with the COVID-19 patients, overflow tents have been appearing all over the city. We've been speaking to one doctor on the front line who could show us inside.
Hello, everyone. My name is Calvin Sun. I am a per diem emergentologist / emergency physician working in the emergency rooms in New York City across the majority of the hospital systems, much like a mercenary or a gun for hire. So we're fighting a war on all fronts now. Not only was I called in last minute to see patients in decompressed emergency room, doing what I do, but also putting together telemedicine and setting up tents and planning mass casualty scenarios. So this is the inside of one of many countless field tents that's being set up outside of our hospitals all around New York, currently being overwhelmed by the staggering patient volume that's occurring because of the COVID-19 pandemic.
Currently working in the COVID-19 only field tent outside a random hospital in New York. As if one tent wasn't enough, now we have two.
Finished another shift, taking care of countless patients. I think I hit 65 today in the COVID-19 only tent, and pretty exhausted. Hospitals that I've been working in are just getting fuller and fuller. They're converting regular medical floors into ICU overflows. I know some hospitals only have one ventilator left. I'm still fighting, and in the meantime, I'm just going to enjoy this view on this way back home because there's a few other things in life right now that I can appreciate and not take for granted.
And Dr. Calvin Sun joins us now live from New York. Dr. Sun, what does it feel like actually on the ground as a doctor right now?
Well, right now is relative, right? It's always worse than the day before in the moment. So the last 3 to 4 weeks, we've just seen things get progressively more dire, people coming in sicker and younger with presentations that we never expected from COVID-19 with papers to back that up, such as strokes and clots. Heart attacks, all associated with COVID-19 infections, and we don't know what to believe in anymore. Those videos that you saw were all taken in the last week, but just like anything in New York, when we meet up and rise to the occasion, right now, it's like the calm before the storm. They're all saying that this is going to be the worst week ever. But it felt like every week has been the worst week ever. Patient volumes, patient critically ill, hospitals being full. Every day has been our apex. I hope that we overreacted. I hope that next week you do a news story and you say that we, totally blew it out of proportion. We have too many ventilators, because I'd rather have that than too few ventilators and having to ration medical care in the United States of America in 2020.
We relished your personal protection kit. It really looked absolutely state of the art. But do other doctors in New York really have the same as you?
No. So I've been lucky to rely on personal private donations by friends and family members. And lucky is even a word that I feel guilty using. It shouldn't have come down to that. Although as grateful as I am to having a support network, I can't speak on behalf, or the same for my colleagues who may not have that support network, who may not have those personal private donations, who only have access to what their emergency room offers. As a per diem doctor, I also have access to different emergency rooms and different things that they have a lot of. I can't. What if I'm a full-time doctor, like most doctors out there, where I lack whatever that emergency room lacks? I have nothing else. So, but it shouldn't have come down to this, where we were having this issue even before this pandemic.